Hello, everyone. I'm Dr. Sri Banerjee, core faculty for the College of Health Sciences and Public Policy at Walden University. And in this segment, I'm going to be going over a phenomenon known as diabulimia. Typically, when I think about diabetes, I think about a starvation state. Even though most people don't know that, increased glucose within the body puts the body in a starvation state. You would think the opposite, but because glucose is not entering into the cells, your body is starving. So, diabulimia is an eating disorder behavior in people with type 1 diabetes where insulin is deliberately restricted or skipped to lose weight. So, it's a cycle actually, and there are warning signs and health risks. Let me explain first how it works, though. The first step out of five is insulin reduced or skipped. So once the insulin is skipped, then glucose within the body is going haywire within the bloodstream. And so the cells cannot consume all the glucose for energy. And then, so because they can't, again, the body goes into a starvation state. The body breaks down fat and muscle for energy. Ketones are produced and blood sugar rises. And the whole thing about ketones, they're released within the body causing diabetic ketoacidosis. So that happens when the sugars go up to about 500 or 600. So the last stage of this is weight loss, harmful and unsustainable. A lot of these things come about because of eating disorders along with diabetes. To a certain degree, because doctors emphasize the low blood sugar, doctors are also indirectly involved. They're not to blame, but by being aware and spreading awareness to patients, this can actually be prevented somewhat. So, what are the warning signs of diabulimia? Well, one is unexplained weight loss, obviously, and then frequently high blood pressure, frequently high blood sugar levels, recurrent diabetic ketoacidosis or hospitalizations, avoiding diabetes appointments, obsessive focus on weight or body image, hiding insulin use or glucose readings, and then fatigue, dehydration, nausea. I like the center of everything because there is a cycle that they're talking about, a vicious cycle that takes place almost like a negative feedback loop. And so the cycle is restricting or skipping insulin, right? And we've gone over this ad nauseum by now, but restricting or skip insulin, high blood sugar and ketones, weight loss, positive reinforcement, being praised because of weight loss or feeling in control, and then continuing the behavior. So when there's positive reinforcement, this goes back to restricting or skipping insulin, and so on and so forth. So this is a vicious cycle, dangerous cycle of insulin restriction and weight loss that puts health and life at risk. So this can turn into diabetic ketoacidosis, nerve damage, peripheral neuropathy, kidney, diabetic nephropathy, and then vision loss, retinopathy, heart problems, fertility issues, and then increased risk of early death. So the treatment approach should be a team-based approach. It's comprised of course, your main support system, the family doctor, but also endocrinologist, diabetes specialist. So they are responsible for the medical care and management. A therapist, like possibly a counselor, that provides guidance for the eating disorder, body image, and emotions. Cognitive behavioral therapy works, dialectical behavioral therapy works. Some of the mainstream therapeutic approaches work. And then, of course, that dietitian can uh, really hasten this process, a positive process of treating diabulimia. And then, of course, the support system is always important: family, friends, loved ones. Um, so what's help out there, what type of help, a diabetes care provider, eating disorder specialist, and then a trusted family member. So this was brought to you by, of course, I created this visual with the aid of AI, and then of course this was from adapted from National Eating Disorders Association (NEDA). Um, so this is in a nutshell what diabulimia entails. I hope this has made some sense. Thank you for listening.